Hello, good evening. My name is Bisola Adeniro. I'm one of the United States University students. I am here to assess my patients. I'm doing the HEENT assessment on my patients today. And hello, how are you? What is your name?
Hi, my name is Michael.
Your name is Michael. How old are you?
I'm 18.
You are 18 years old, and this is for educational purposes, and I just want to get your consent. Would it be okay for me to record you today?
Yes.
Okay, my patient is agreeing to me recording him for my HEENT assessment today. So I'm going to wash my hands. My hands are washed. And now I'm going to inspect my patient's head. And right now I'm inspecting your head, looking at the head, looking at the shape, making sure there's no deformity. I'm making sure that the shape is symmetrical and there's no mass noted, there's no lesion as I'm looking at it. And the head is normal cephalic. So I'm going to now palpate the head. I'm going to feel around the head for any mass, any lesion, any tenderness, any rash, and at this time I did not notice any depression on my patient head, and there's no rash, there's no hematoma. The head is full and equal. Okay, so any tenderness when I was palpating your head?
No.
No. Oh, awesome, that's good. The head assessment is normal. Now I'm going to now look at my patient face, and as I'm checking his face, I'm looking for the face. I'm checking the skin color, if there's any discoloration, and at this point there's no discoloration. The skin appear moist brown in color, and there's no rashes noted, so which is good. That is perfect. So at this point, I am going to test for facial nerves, which is cranial nerve number 7. I'm going to ask you to clench your face for me. Awesome. Can you give me a smiling face? Awesome. So this shows that my patient cranial nerve 7 is working perfectly. Okay, can you clench your cheek for me? Okay, awesome. So this shows that your cranial nerve 7 is working perfectly. Alrighty, awesome. So while I'm on the face, I'm gonna check on the cranial nerve 5, which is the trigeminal nerves, and I'm going to palpate the temporal pulse, which is right here, and it is pounding and it is normal as I palpate the temporal pulse. So now I'm gonna ask you to clench your jaw for me. Okay, good. Okay, now release. I want you to open your mouth, and close. Open and close. Any tenderness?
No.
Okay, any pain?
No.
Okay, so at that point, I'm checking for any cracking or any pain in my patient's jaw. So, and it shows that my patient have free range of motion on his jaw as I just assess the cranial nerve 5. So now, I'm going to check my patient eyes, and first thing to do is to inspect the eyes. And as I'm inspecting my patient eyes, there's no drainage. There's no drainage, and there's no redness. There's no edema around the eyelids. The eyelashes are equal. They look great. Your eyebrow looks symmetrical, and there's no swelling. There's no lesion around your eyes. Okay. So now I'm going to check your lower conjunctiva to check for the color, if there's any discoloration. And then now that I've just checked it, it looks pink and moist, which is a normal finding, as I've just checked. So there's no discoloration, there's no swelling, and there's no jaundice noted. And now at this point, I'm going to check the upper eyelid. Can you lift your head up for me? Okay. And it looks moist and it is pink, and there's no discoloration noted, and there's no discharge at all. So at this point, I'm going to now check the clearer of the pupil. Can you open your eyes for me? Okay, awesome. It is clear, it is shining, and yeah. So as I'm checking that, also I'm looking at the pupil, and the pupil looks equal, and one is not bigger than the other one, so that means they are normal findings. So now at this point, I'm going to get my pin light. So I'm going to shine the pin light on your eyes, and I'm going to be checking for reflection. Okay, and I just want to see how your eyes is conducting to the light. Okay. Okay, can you look up for me? Okay. So as I'm checking this, I'm also checking for cranial nerve 3, which is the oculomotor, and everything looks great. So at this point, I want to turn off the light, and then I want to see how my patient pupil reacts to light in the dark. Okay. So I'm going to ask you to open your eye wide. Why I'm gonna shine the light in your eye. Okay, his eyes were dilated, so I can see that the pupil reacts to light on both sides. Now I'm gonna turn on my light so we can have light. Okay. So now I'm gonna check my patient's eye accommodation, and I'm gonna see how his eyes is able to follow the light. So just follow this, trace this light, or follow this light. Okay, turn your eyes as you see this light move. Okay. I need you to move your eyes as, okay. Okay. And now I'm going to check for the 6 cardinal points as well. So I want your eye to follow this pen, okay? I'm going to move it. So now I'm going to take my otoscopy to check for his eye reflex. I'm going to check for your inner eyes reflex. Can you open your eyes for me? So my right eye, we go to your right eye, okay? Okay. There's no redness, so I'm gonna check this one. Okay, and there's no redness as I check. Okay, so now I'm going to use this net test, and I'm gonna have my patients read from far distance. I'm gonna stand by 6 feet, and I'm gonna have my patients to read. Close one eyes for me. Okay. Use your hand to cover your eye. Can you read line 4 for me?
O L C F.
Okay. So can you read the last line for me?
L T F F H.
H. Okay. Um, do the other side, the last line.
L T F F H.
Awesome. So my patient have a vision 20/20, which is normal with this net test. That is a normal finding. So now I'm going to check for the ear, and at this point I'm going to check my patient's ear to check for the size of the ear and make sure that it is symmetrical, and there's no the outer ear, there's no any lesion, there's no wound, there's no rash, there's no edema noted. So at this point, as I'm inspecting my patient ear, there's no edema noted, there's no lesion, and the ear looks symmetrical. And at this point, I'm gonna palpate for any tenderness. Do you feel any pain?
No.
Okay. There's no pain, and there's no mass, there's no swelling around the outer ear, which is good. Awesome. So now I'm gonna take my otoscope, and I'm going to look into the inner ear. And as I'm doing this, because he's an adult, I'm gonna pull his outer ear up and back for me to look into his ear. So I'm pulling up and back. So right now we are checking the inner part of the left. The cone of light on the left is at 7 o'clock, and there's no fluid noted. The ear canal is pink and clean and moist. The only thing I see is fine hair, which is normal finding. And now I'm going to the right side as well, and I'm going to pull the outer ear up and back for me to check the inner part of the ear, and the shiny light on the right side is at 5 o'clock. The cone of light there is at 5 o'clock, and the inner ear is moist pink, No swelling. The only thing there is fine air, which is normal finding. All right. And at this point, I'm going to do the Weber test, and I'm going to do the Weber test and the ring test. And how this works is I'm going to hit this on a substance, and you will tell me when you can no longer hear the sound. And I'm using my turning fork. I'm using my turning fork for this. Can you hear it on both sides?
Yes.
Okay, good. That is a normal finding if my patient can hear on both ear side. That is considered the Weber test. And now I'm gonna do the Rene test. But I'm gonna put it at the base of the skull, or we call it maxillary bone, behind the ear. Can you hear?
Yes.
Tell me when you cannot hear anymore.
I can't hear anymore.
Okay. Can you hear?
Yes.
Tell me when you cannot hear anymore.
I can't hear anymore.
Awesome. That is good. That is a normal finding. So that just tells us that the bone conduction is shorter than the air condition, the air conduction. So the bone conduction is shorter while the hair conduction is longer. So now I'm gonna whisper some words, which is considered as a whisper test. So you tell me what you hear as I whisper on your left ear, okay?
44.
Awesome. So I'm going to close the left ear and whisper to your right ear. What did you hear?
99.
99. Awesome. So as I have just done that, I just checked for cranial nerve 8, which is vestibular cranial nerve number 8. So now that is a normal finding. So at this point, I'm going to check my patient's nose. And I'm gonna inspect your nose. I'm checking it for shape. I wanna look around it, if there's any swelling, if there's any rash, if there's any congenital deformity. And as I'm looking at my patient, there's no deformity, and there's no any rash, there's no discoloration around the nose. So at this point, I'm going to palpate your nose. So I need a glove. So now I'm putting on my glove. So I'm gonna ask you if you feel any pain as I'm going to palpate your face. I'm doing your frontal right now. Do you feel any pain?
No pain.
No pain. And now I'm checking your maxilla. Do you feel any pain?
No pain.
No pain. Awesome. So that is a normal finding. So now I'm going to have my patient lift his face up, and I'm going to look into the nose, the nasal canal. So I'm going to check the turbinates of my patient's nasal canal, and it looks pinkish, just some dry mucus, which is normal, and some fine hair. So the assessment in the nasal canal is normal. Okay, there's no swelling, and it looks pink, some redness, but which is okay. So now I'm going to do cranial nerve number 1, which is the olfactory nerve. So I'm gonna have my patient close his eyes, and I'm going to put something on this peg and have him smell it and tell me if he can smell, and then tell me what he can smell. Okay, I'm gonna close one of your nose. Can you smell this?
Mm-hmm.
What does it smell like?
Hand sanitizer.
Hand sanitizer. Okay, can you smell this?
Yes.
What does it smell like?
Hand sanitizer.
Hand sanitizer. So that is a normal finding. So that shows that my patient's cranial nerve 1 is normal finding, which is olfactory nerve, is functioning properly. So now I'm also going to check for patency of my patient's nose. So I'm going to have you close one nosary and have you blow through the right side of your nose. Blow. Awesome. I'm gonna close the right nosary and have you blow through the left nosary. Awesome. My patient have a patent flow of both nosary. So that just shows that there's no blockage. My patient can breathe normally without no distress. So now I'm going to check the neck. I'm going to go to the neck. Okay, I'm gonna pause. I think before going to the neck, I have to go to the lips. So now I'm going to check the lips for any discoloration. I'm gonna check for any dryness. I'm gonna check for any cracks. So looking at my patient lips, it looks pinkish. It looks moist. There is no crack. There's no dryness, so which is a normal finding. So now I'm gonna ask my patient to open his mouth. So I can at this point I'm checking for dental. I'm trying to make sure that there's no loose teeth. There's no loose tooth anywhere, which is good. And now, so at this point, I'm checking the soft palate and the hard palate. Open your mouth. I'm gonna use my light. Open wide. Bring your tongue out. Bring your tongue out like this. Okay. Bring it out. Okay. I'm checking the uvula, which is at the midline. I'm checking the upper palate. Lift your tongue up. Okay. To the side. To the other side. Awesome. There's no mass. There's no lesion. And they are all moist and pink, which is normal finding. So as I've just done that, I've just checked for cranial nerve number 9, which is pharyngeal. Also pharyngeal. Open your mouth. Okay, awesome. You can close it. So now that we are done with that, I'm gonna Okay, so I need to check for your gag reflex before I move on. I just remember that. I need to check for your gag reflex. So I'm going to use this tongue blade to compress your tongue down. And I just want to open your mouth. Bring your tongue out. No, relax your tongue. Okay, awesome. My patient have a good gag reflex, which is cranial nerve 12. Number 12. Okay, so now that we are done with that, I'm going to, and I've already know that my patient was able to talk back to me as I was asking him question. So that means my patient is able to speak clearly, which is cranial nerve number 10, and I've just checked on that. So there's no hoarseness while he's talking to me. He does not have a slur speech, which is good. So at this point, I'm going to move to your neck, and I'm going to check your neck to make sure that there is no deformity, there's no swelling, there's no rash. And as I'm checking around and also standing in front of my patient, the neck looks symmetrical. There's no mass, there's no swelling. And the color also is normal. There's no discoloration, and there's no lesion. Okay, so that is so can you lift up your shoulder for me? Okay, awesome. Put it back. I just checked for cranial nerves 11. That is the accessory muscle. I just checked to see that you can use your accessory mass. Okay. So now I'm gonna, as I'm assessing his neck, I'm gonna check his trachea area. I'm assessing for any swelling, and as I check, there's no swelling and there's no any discoloration. So I'm going to come behind my patient and I'm going to ask him to swallow. And as I'm checking the trachea, okay, swallow. Any pain, any tenderness? So there's no mass, there's no bulginess. So it is symmetrical, which is normal. So at this point, so now I'm going to also palpate your carotid artery. Can you lift your neck up? So I'm going to check on the left side, which is palpable. And I'm going to go on the right side as well. It is palpable. That is good. So I'm also going to auscultate and listen to your carotid artery. I want to check for bruise. So there's no bruise, because if I have had bruise, it would have been abnormal. And I'm auscultating on both sides to check for bruise. There is no bruise, and that is good. I'm also gonna auscultate for your tympanic artery. There's no bruise, which is good, which is normal. And I'm checking on the other side also. There's no bruise, which is normal. Okay. So now I'm going to, so now I'm going to check for neck movement. So I want you to turn your neck to the right side. Okay. And turn to the left side. Can you move your head up? And can you look down? Okay. So I have just have him do the range of motion on every side, which I'm checking for jugular motion. Okay. So then the next thing I'm going to do is to check for the lymph nodes. I want to make sure that the lymph nodes are not palpable. Okay. So now I'm going to have my patient lift up, and okay, okay. So there's no lymph nodes palpable, which is normal, which is good. No lymph nodes palpable at this point. Um, the posterior and anterior lymph nodes are not palpable. Okay, so and this conclude my assessment, my HEENT assessment, and I just want to thank you for allowing me to use you as my patient today, and thank you very much. This ends the assessment of the HEENT. Thank you very much.
Thank you.